Hello and happy Pride. I am Dr. Ashley Williams. I am a board certified Permanente physician. I'm board certified in internal medicine, and I have the luck of working with the Permanente medicine group. I work in the adult and family medicine department at the Capitol Hill Medical Center, and we are very, very excited today to talk to you in celebration of Pride Month. I am joined today by my incredible colleagues, Dr. Keith Egan, Dr. E.W. Emanuel, and Dr. Stephanie Letourneau.
Hey there, I'm Dr. Keith Egan, a board certified primary care physician at the Capitol Hill Medical Center with the Pride Medical Clinic. Thank you all for joining me today. Been working here at Capitol Hill for about 5 years now, working in primary care and LGBTQ healthcare, and I'm looking forward to the discussion today.
Hi, I'm Dr. Stephanie Letourneau. I'm a board certified family medicine physician. I am part of the Pride Medical Group. I've been working at the Capitol Hill Medical Center at Kaiser for 6 years now. I've been working in primary care for almost 20 years, most of them in the DC area, including 9 years with the Whitman Walker Health Group. And I'm looking forward to have a discussion about our Pride Medical Group today.
And hello, I'm E.W. Emanuel. I'm a board certified OBGYN working at the Capitol Hill Medical Center Pride Clinic. And I've been working with Kaiser Permanente for nearly 24 years. Welcome.
Thank you all for those great introductions. So for those of you that are joining us live, please feel free to post any questions or comments in the comment section, and we'll be sure to try to answer some of your questions live. So we'll start with you, Dr. Emanuel. Why is it important for LGBTQ+ patients to have specialized care? Are there conditions that are more likely to impact people in this community?
Well, most marginalized community, whether through discrimination, stigma, violence, social, political, economic impact, have significant medical conditions, chronic disease, that can be truly related to their how they're treated, how they're viewed. It severely affects their access to care. In particular, you can look at any physical or mental ailment and can trace it back to how they have been marginalized or discriminated against or violence against them. So I'd say particularly HIV, AIDS in our trans community, especially trans women, sexual and physical violence, domestic partnership abuse, I could say substance abuse, depression, are just a few. There are higher prevalence to disability in this community. So I would say having a specialized clinic is where we can provide culturally competent care is highly important and specific.
Thank you, Dr. Emanuel. Dr. Egan, what is Pride Medical and how does it offer specialized care? Who is a part of the Pride Medical, and are there doctors who don't necessarily work at Pride Medical but are still considered preferred providers?
So Pride Medical is a clinic that we started and opened up about a year ago. And the idea behind the clinic was to create a distinct space where patients from the LGBTQ+ community could come and know that they were receiving care from providers who are trained and experienced in working with this population. We wanted our Permanente members to be able to identify that safe space very clearly. And whether they are choosing to interact with us through a video visit or phone visit or come and see us in person, know that they'll get the care that they deserve. And so at Pride Medical at Capitol Hill, at the physical location, we created a nice welcoming environment with our own distinct waiting room for the clinic. We have trained our staff from the front desk to our clinical assistants and nurses and the physicians, of course, to be able to provide culturally competent care to the entire LGBTQ+ community. And as part of our clinic, we have myself and Dr. Letourneau as primary care providers. We have Dr. Emmanuel with an experienced GYN, and we have a designated case manager who helps our patients with navigating the healthcare system with Kaiser Permanente. In addition to this distinct group at the Pride Medical Clinic, we have a whole network of preferred providers within Kaiser Permanente who are experienced with working with this population as well. These include a number of other primary care providers, but also behavioral health specialists, dermatologists, cardiologists, the whole spectrum of care that Kaiser Permanente offers. We've identified providers with experience in this population. And as patients see us in Pride Medical, we're able to take advantage of this network and refer patients to providers who we know will have a welcoming hand that they can extend and create a safe environment for our patients.
Thanks, Dr. Egan. And I'm so glad we were able to share the beautiful space that has been created for Pride Medical. There was so much detail and planning and care that went into it, especially in involving people from our own community to provide artwork. You guys, it's really just done amazing things with the work that you've done. So congratulations on that. I know a lot of time and care went into that project.
Thank you. We were very lucky to be able to partner with LGBTQ plus artists in the community to create those pieces of art to make a welcoming environment for the patients to come in.
Yeah, and it's just so great to be a part of an organization who really supports and invests in our community. Okay, thanks. Dr. Letourneau, why is it important to have doctors that are culturally competent to serve the LGBTQ plus community?
It's important to have providers because primary care is all about having a conversation with your doctor, with your physician, about what is going on with your health and what is going on in your life so that you can create with your doctor an individualized plan of care and of preventive care to address what's going on for you. And to have that conversation, most people feel more comfortable if they speak to someone who can at least understand, be open to their point of view in a non-judgmental way. So to have the option to have a culturally competent provider is our way to make sure that all patients can come in the office with the trust that they can speak to someone, that they can speak to their doctor and be completely open about any topic that they want to be open to on that day so that we can create the best plan of care. And it's really, you know, if you are afraid to disclose something to your doctor, it may impact your health in the future in a way that could have been avoided. So it's really important to choose a doctor that you feel comfortable with and to maintain that relationship.
Thank you, Dr. Letourneau. We actually have our first question in the chat. So if one of you could answer, does Pride Medical offer pediatric care to teens under 18?
So at this time, our Pride Medical Clinic serves our patients, our LGBTQ plus patients who are 18 plus, but we do have a number of providers on our preferred provider list, which is available on kp.org, who are identified as having experience working with pediatric patients, whether it's younger children or teens who need these services. So please do check that list out.
Thank you, Dr. Egan. Dr. Letourneau, thank you for your previous answer. What would you say to people who are nervous about coming out to their doctor? What are the benefits of being out to your primary care provider or your OBGYN?
So the benefits are potentially really great. I mean, I think in the medical community, we have to recognize that we have not historically always been completely open to some of the marginalized population and certainly to some of the LGBTQ population. And so if you're uncomfortable, if you feel uncomfortable with your doctor, I think that you have to follow. I mean, you can try to ask the question and then make sure that your doctor feels comfortable talking about it. And if not, then you look for another provider in your network, right? And that's why we have created the Pride Medical Group. We want to make sure that for those people who feel maybe a little bit less confident when coming out to their physician, that they have an option out there that is that is identified as an informed and knowledgeable and experienced provider who can provide you the environment so that you can have those conversations and feel comfortable and feel confident that you'll be out. You know, if you trust us and have those conversations with us, you will find that we will be able to help you take care of your health in a more personalized and in a more targeted way, and you will end up with a better experience.
I love that, Dr. Letourneau. One of the goals being building an environment of trust so that people feel safe to talk to you.
Absolutely.
So Dr. Egan, so what would you say to those people who are in the phase of questioning gender or sexual identity? Is that something that you should talk to your doctor about?
So kind of following up on what Dr. Letourneau says, it depends on how comfortable you are with your provider and the relationship that you have with them. But if it's something that you don't feel comfortable sharing with your provider, it's probably a cue that maybe it's a good time to look around and see what is available in your network. At Kaiser Permanente, Pride Medical is a good place to look to have a discussion with your primary care provider or a doctor who is just available for a one-time visit to have a discussion with you. But it is important to have these discussions with your provider so that you can ask any questions that you have about your health and how the changes and the questioning, whether it's about sexual orientation or gender identity, might affect your health. And that's why we're here, to answer those questions and have those discussions with patients. As a gay man myself, I remember how terrified I was when I first went to have an appointment with my primary care provider. And I knew that I was going to tell her that I was gay, but my heart was racing and I was nervous going in there. And luckily, the provider was open and had a very comfortable discussion with me. But it was terrifying not knowing going into that conversation how it was going to be received. And so we want patients to come into Pride Medical and know ahead of time that they're going to meet an experienced and welcoming physician who they can feel open having those discussions. And for Kaiser Permanente members, that can mean transferring your care as far as primary care or GYN care. But it can also mean just coming in for a single visit with us and having a discussion and asking about the Pride Medical Clinic and asking questions that you have about your sexual orientation or gender identity or just things that you're questioning, even if you don't want to transition your care in a longer term.
Thank you for sharing that personal story, Dr. Egan. I think having gone through something similar, it makes you, more empathetic and able to relate to a lot of the members that you serve. So let's talk about the services that Pride Medical offers. And forgive me, Dr. Egan, this is going to be a series of questions. So services that are provided within Pride Medical, are you doing STD testing? Are there any specific health concerns that the members that come to see you should be aware of?
Yeah, great question. So in general, the majority of what we provide, the three of us, are similar services to what you would receive anywhere else in healthcare. We want to make sure that you are up to date on your immunizations, that you're up to date on preventative healthcare services like cancer screenings. We want to make sure that we're screening for things like diabetes. We want to make sure that we talk to you about smoking cessation if you're a smoker, talk to you about substance abuse risks. And so these are conversations that we have in primary care with all of our patients. And the biggest difference is that as experienced providers with this population, we have kind of a unique skill set to be able to tailor that discussion to the individualized patients and make sure that that we're meeting all of their needs. So very similar services to what we provide, but in a way that we can kind of customize them for each of our patients. We do offer STI screening if that's what is appropriate for the patient. You know, for our transgender and gender expansive patients, we offer gender affirmation services, whether it's hormone therapy, whether it's surgery or other services. All of that can be our services that we provide at Pride Medical. Dr. Emanuel might have other comments on what we provide as he provides as a GYN provider with Pride Medical.
Thank you, Dr. Egan. Let's see, Dr. Emanuel, what would you say to someone who isn't comfortable with their body or the sex that they were assigned at birth? What are the first steps that that person should take?
Well, a relationship with their doctor that they trust, I would say, first step. Second step is we have behavioral health therapists who are experienced with this community. And it's a journey, a transition. You know, it's they're finding out, what does this mean? And I think a referral to a behavioral health therapist that is very versed, comfortable with this population is a way to go. Now, I'll also say the doctors on this panel here are pretty comfortable in screening and identifying, and will make the appropriate referral as needed. I'm comfortable in identifying and providing the diagnosis. My colleagues in GYN are aware of the program, our clinic, and will also make the appropriate referral. But I think, to answer you more directly, is first find a therapist, a provider that's you're comfortable with, and second, get the appropriate referral to someone who can help you with that transition.
Thank you. I really love how you emphasize there's a team here, right? It's a team approach. There's not just the people on this panel that can help you, but we have behavioral health specialists, we have case managers, we have an entire team of people who can help navigate you through the system. And then the other thing with Dr. Egan, our emphasis on preventative care, no matter where you are in your journey. So if any Kaiser Permanente members are on the Facebook Live, you know how big we are about preventative care. Okay, Dr. Letourneau, what are some services that Pride Medical offers for people identifying as transgender?
Thank you for your question. Actually, many patients come and for their first visit, and that's their first question to me is what can Pride Medical do for me for my gender affirming care? You know, I'm a primary care provider, so I start with primary care always. And so I provide primary care. We also have behavioral health therapists like Dr. Emanuel was mentioning. You know, I have a conversation with patients as to what they see as their pathway to gender affirmation. What steps do they see as part of their care? And sometimes people come to me completely decided knowing what they want, and sometimes they're still trying to understand what gender affirmation means for them. And so, you know, we can have conversations. I can help with that. Behavioral health can help with that. We have also a great care case manager who helps with the care coordinations. There can be many different appointments that need to be coordinated, maybe different steps that need to happen before this and that can happen. And our case manager is really there to help patients not get lost in our system and make sure that they keep up with all the requisites at each step. We offer, of course, gender affirming hormone therapy. It can be done in primary care, or it can be done with endocrinologists, also depending on patient's preference. And we also offer gender affirming surgeries and access to some gender affirming surgeries depending, some of them are available within our networks, and some of them are, for some of them, people have to go out of network. It also depends a little bit on people's insurance plans. So our case manager can help also people understand what, how their specific insurance plan affects what is available for them. But we work as a team, we work as a group. I make sure that all the primary care needs are met in team with the primary care provider of the patient. If they don't want to switch to us, sometimes they want to keep their excellent primary care provider and just use us as counselors, as someone can give extra advice. And we try to come up with a plan that meets all of our transgender patients' needs as a team.
Great. It's so great that we have so many resources within Kaiser Permanente. But it's also great to hear that we, at the end of the day, want to do what's best and what's right for our members or our patients. So if there's a need to refer out, then that will happen. So thank you for that, Dr. Letourneau. Dr. Emmanuel, what would you say to a patient that didn't feel comfortable coming out to their family? Is there someone within our system that they can talk to about this?
Again, yes, we do have counselors. We do have behavioral health therapists who can help them on, again, transition the journey, how to speak with a loved one, mother, father, family member, siblings. Also, at times, a therapist to help them speak with their provider. They are, as I said before, and my colleagues as well, it's a transition. It's a journey. There's the stop point is when the patient identifies that I'm at that place where I feel affirmed or authentic or true to myself. Speaking with a therapist, a behavioral health therapist, helps in many ways, not just the mood, but the mental. Being comfortable and feeling safe is a mental, is as much as a mood as well as a mental. And I would say that the first step is with our behavioral health therapist.
Thank you, Dr. Emmanuel. Okay, Dr. Egan, do you have any advice for allies or people who don't identify as LGBTQ+, but want to help support this community?
Yeah, that's a great question. Thank you. Within the healthcare community, I think just keeping in mind that many members, unfortunately, probably most members of this community have at some point or another, most often repeatedly experienced discrimination, whether it was in healthcare or in their day-to-day lives. And those experiences add up over time. And it makes it very difficult to trust individuals and to know how individuals are going to respond to you. So if you are an ally and you identify as an ally and you're thinking in your head, I am very supportive of this community, go out of your way to make it obvious that you're an ally, whether it's kind of getting involved in a program like our Preferred Providers Program, whether it's going and getting additional training, whether it's wearing a rainbow pin on your white coat, or patients don't know what you're thinking in your head and how you're going to respond to them. So being very careful with kind of how you're choosing your words and how you're presenting yourselves to patients is a good first step, and going out of your way to get some training. Because just being open to the ideas of a community and feeling comfortable with the progress that has been made for these communities isn't always enough. Kind of learning more about those communities and the struggles that they've faced makes a big difference in how you're able to stand up for these communities and provide care.
Thank you, Dr. Egan. And thank you, everyone, for our very amazing panel today. Thank you to all of you for joining us today. If you enjoyed this conversation, please share it with your friends. You can also follow us on Facebook, Twitter, LinkedIn, YouTube, and Instagram. You can learn more about our integrated multi-specialty medical practice and find lots of great health information on our blog at kp.org/doctor. From all of us at Permanente Medical Group, be well and happy Pride.